So, as you know, with the COVID pandemic at the moment, what we're trying to do is we're trying to reduce the amount of face-to-face contact that we have with anybody in the community, but as doctors, we're also trying to do that with our patients. And so we're using a technology called NHS Near Me to be able to have consultations with our patients and to be able to see each other face-to-face through video link rather than sitting close to each other. Okay, so how NHS Near Me works is, or how we use it here, is we would give you a call on the telephone. We would just confirm with you who you are, ask your date of birth so that we're sure we've got the right person. And then if you're comfortable with using NHS Near Me, then what I would do is to ask you for your email address, and then I would send you an email with a link on it, in it. What you then do is click on that link, and that brings you into the NHS Near Me, and we are connected face to face. So there's a waiting room, so you come into the waiting room and then I just accept it and then you come in. It's like as if you've actually come to the GP surgery, and hopefully I won't keep you as long as I do sometimes, I know. With these things, the technology, I think we always feel slightly anxious, and we often feel anxious when we've got video conferencing added on top of that. But the technology is really very simple, and I think that once you've got used to it, once you've got into it, I think you will be able to feel more relaxed. And I think the reason I particularly like it is because I think we can establish a relationship so much quicker and so much more easily, not dissimilar to if you were sitting in the same room as me. Hello, is that Rose? Rose, it's Dr. Charlie Siderfin here, just phoning you from the assessment centre. Can I just check with you? Could you just tell me what your date of birth is so I'll make sure I've got the right Rose? Lovely, great. Rose, we've got a bit of technology called NHS Near Me where we could see each other face to face with a video link, and that would give me a lot of benefit, and hopefully it might be beneficial for you as well. Would you feel comfortable doing that with me? Okay. What I'll do is, if you could give me your email address, then I send you a link, and all you need to do is just to click on that link, and that will then bring you in to see me. Hello Rose, I'm Dr. Charlie Siderfin. How are you doing? I'm sorry to hear you're not well.
I haven't been for a few days.
Right.
I don't think I could have made it into the surgery.
Rose, that's fine, because at the moment we're not wanting patients to come into the surgery at any rate, so we're really glad to just speak to you on the phone, and then using this link is fine as well. So can you tell me, how did this all start and when did it start?
Oh, I think it was a few days ago now, and I don't seem to have any energy anymore. I'm hot and sweaty, and last night was terrible. So sweaty and feverish. I just never felt like this before.
Oh Rose, I'm sorry to hear that. So just tell me a little bit more. In terms of your fever, what's your fever like when you've got it? Are you sweaty with that?
I'm hot, yet sweaty. I had to change the sheets last night. I was sweaty. I've been through the day as well. Through the day.
And have you been taking anything like paracetamol for that?
I've tried paracetamol.
And has that helped at all?
Not really.
Okay.
I don't feel.
And have you had the shivers and shakes at all?
Feverish, yeah.
And have you had the shakes? Have you had episodes when you've been shaking?
No, I haven't. Not really.
Okay. Good. Tell me about... Okay, so you saw in that clip that we've just done with Rose, who was acting, how the technology works. And you'll also have noticed that the picture quality at times wasn't as good as maybe we would like at all times, but that's because Rose is actually in Westbury, where we know that the internet connection can be a little variable at times. So I think that was quite a nice demonstration of how the technology can work even in adverse circumstances where the broadband isn't maybe as good as we'd like it to be. Okay, so sometimes I have to ask questions twice, maybe because I've not heard properly or because I just want to get a little bit of additional information. And you'll notice, to begin with, what I asked Rose to do is just to describe in her own words how she felt, and for me just to listen and hear that. And then I started asking her more questions, drilling things down to be able to get a much clearer idea in my head as to how unwell she was. And that's really important, because what I need to do is to make that clinical assessment of how you are, and then as a result of having made that assessment, decide on what we should do together. And it's always, the important thing is it's always a shared decision making between yourself and the clinician. And I think you'll have been able to see that for me, it was great being able to see Rose, to see how she was, to see her coughing, to seeing that she was actually a bit breathless. I got a bit of a feel as to how she was looking. And so there's lots of additional information that we can get through a video conference which we don't get on a telephone. And I think the other thing, hopefully for Rose, is that seeing me is in some way reassuring. I guess many people feel uncomfortable about being on video conference, but if I can do it looking like this, surely you can as well.